Hello, today we will be talking about how to prevent falls in older patients in care facilities and hospitals. We have gathered data from the National Guidelines Clearinghouse, the Joanna Briggs Institute EBP database, and the Cochrane database of systematic reviews to put together these recommendations for the best evidence-based practice in preventing falls in older patients. The first step in falls prevention is to assess the patient to see if he or she is at risk for falls. All three databases suggest that each patient should have an individualized falls risk assessment reviewing both intrinsic and extrinsic risk factors, including a fall-focused history, physical examination, functional assessment, and a review of medications. This falls risk assessment should be an integrated part of the multidisciplinary plan of care. There are several interventions that the care facility or the hospital can implement to prevent falls, as recommended by the National Guidelines Clearinghouse. The facility should monitor incidents of falls and patient injury due to falls, comparing the rates on the same unit over time. The facility should also compare their rates against the national benchmark. This allows the facility to identify which units may need further education on falls prevention and incorporate continuous quality improvement into their falls prevention program. The facility should also consider the extrinsic risk factors that may contribute to falls and work towards eliminating them if possible. The Joanna Briggs Institute shows that safety interventions such as keeping the floor and walkways clear can reduce the incidence of falls in older people with a history of falling. Likewise, the Cochrane database shows that using carpet flooring instead of vinyl greatly increases the rate of falls.
So in continuing our discussion of preventing falls in older adult patients in hospitals and long-term care facilities, one of the key interventions set forth by National Guidelines Clearinghouse and supported by both Cochrane and Briggs is promoting early mobility in patients, getting them up and moving. According to the Cochrane database, that's especially effective in subacute units, not so much effective in higher acuity settings. Those patients actually had the adverse effect of increasing falls the more that mobility was encouraged there. According to Briggs, it was specifically muscle strengthening and balance exercise programs that had the effect of reducing falls in patients in hospital settings. Now, according to Cochrane, the most effective intervention in this whole issue was a multifactorial intervention that they tested in hospitals, and that consisted of three factors: a falls risk brochure to educate the patient, an exercise program, and also hip protectors, which the patients could wear in order to cushion themselves if they did happen to fall and prevent fractures. Now, in nursing homes, Cochrane found that vitamin D supplementation was actually an effective intervention. Perhaps the patients didn't have enough vitamin D in their regular diets, and that was found to be very effective. Other interventions the National Guidelines Clearinghouse mentions and that are supported by Cochrane and Briggs are low-rise bed, that's 14 inches from the floor, making sure the patient has easy access to the call light, and regular toileting at set intervals. Also the use of pressure sensor alarms, those could be bed alarms or chair alarms, and making sure that they're wearing rubber-soled shoes or non-skid socks when they're ambulating.